Welcome back. Now we're focusing on the teeth. Well, you might say we're looking at the teeth more often these days than we used to. The teeth are very important, obviously. Without good teeth, you can't even enjoy your food. We're looking at Sensodyne Rapid Action, and it provides clinically proven rapid relief for sensitive teeth. Many of us do have sensitive teeth, and it will be interesting to find out actually what causes sensitive teeth. You take cold water and it's like an electric shock. So how can you prevent that?
It goes straight to your brain.
It hits you in the brain. I'd like to welcome a dentist, Dr. Ikenna Onyeno. Good morning.
Good morning.
As well as the brand manager, Sensodyne and Parodontax,
That's right. Good morning.
Dr. Davis Iyoha.
Good
He's
morning.
also a dentist, by the way.
Yeah.
Thank you very much.
Thank you.
Now, let me begin with the dentist on this side. What is tooth sensitivity? Yeah, I just said it hits you in the brain, but what is it?
Thank you very much for your question. Tooth sensitivity is a kind of sharp pain you experience when you take something like cold water, cold drinks, or even food. It's a sharp pain that is of short duration, but it's very intense.
And what could cause it?
Okay, there's a lot of factors. You have cold water, you have other
Oh,
factors.
you mean drinking cold water too much can cause your teeth to become sensitive?
Yes. Then there's some other factors like hot food. You get. So when they pass through the nerve fibers that transmit this pain.
Okay. Let me ask Dr. Davis Johan. When you look at that, and a lot of people do, my father in his lifetime, he couldn't eat anything that is not very hot.
Okay.
So you think, okay, if you eat something very hot, and that's likely to impact on the sensitivity of your teeth.
Yeah.
So you begin to wonder, what is it you're supposed to be doing in that kind of situation? Keep your food warm rather than hot. Don't have it too cold because it would. Where do you stop?
For sensitivity, tooth sensitivity, when you take things that are cold, things that are hot, all those are contributory triggers, as it were, that, causes or stirs the pain. But what we've seen is that, beyond that, the things that directly impact in leading to that condition, would stem from things like when the gum, the level of the gum recedes below the regular level, maybe from aggressive brushing. And at the same time, because of the diet we're eating now, acid foods and so on and so forth, all those things can wear away the outer layer of the tooth and expose the softer middle layer, So when things like that occurs, people who eat hot or cold foods, they easily respond to that trigger that causes the pain, But that's one reason I'm sure we're having this conversation so that people
So
can...
Sensodyne Rapid Action then, how does it work?
To
Is
the
it
rescue.
to the rescue? How does it come to the rescue?
All right. Sensodyne Rapid Action, it's one of the products coming from the staples of GlaxoSmithKline Consumer Nigeria PLC. And we've invested a lot of research behind this product. And indeed, we have some people who have been using our other forms of Sensodyne, but that takes about 2 weeks before the full effect sets in. Some people just want instant relief, So Sensodyne Rapid Action is that solution that has been born out of our research, and it works instantly. When it's applied to the tooth, within 60 seconds, it gets to work.
That sounds like miracle drug of some sort, because somebody mentioned that all you need is get a bean size of it and rub it around that tooth or teeth, and that it works. Is that true? And how true can that be?
All right, that's true. A researcher, Mason et al., in the Journal of Clinical Dentistry 2010, he actually did a little study to actually test that out. And what they found was that if you take a pea-sized amount of Sensodyne Rapid Action and you apply it to the area of the tooth that's sensitive, they found that there was a 46% reduction in response to the triggers, that cause the pain. So, for example, after 60 seconds of applying that pea-sized amount, those who experienced pain from cold drinks or hot foods or sweet foods, that pain, reduced within 60 seconds. So it's clinically proven, and the research is out there, So it's a remarkable formulation, and we just want the people, to be aware that this is also
How
available.
much fluoride is in it?
Okay. Oh, in Rapid Action.
Yes.
Okay. Well, I know the fluoride question always seems to creep up. Sensodyne Rapid Action, it actually contains over 1,000 parts per million fluoride. And that's just a terminology that is used to describe, whether the fluoride levels is
high
or
or
low.
Yes.
And at that level, it's actually within the safe dosage for
Okay.
adults to use.
Okay.
So, and again, within our environment, taking certain things into consideration.
Yes. Speaking of, it's safe for adults to use. How safe is it for children?
Well, Sensodyne Rapid Action is not indicated for children under 12 years of age. You get so
So kids under 12 should not
children-
be
not at
encouraged.
all.
Okay.
But they can use the ordinary Sensodyne.
Well, there are other children formulations in the market. Please, what's the name of the?
Okay,
Yes.
so we have a product from the staples of GSK as well, McLean's Milk Tea,
Yeah, for
that's
children.
suitable for children.
Yes.
Okay. But what about if your child has sensitive teeth? What
Okay.
do you use for him or her?
Okay, all right. Well, again, I'll still throw that back to Dr. Ikene, but what we'll recommend is, they consult their dentist, and then based on the advice that they receive, So in some rare cases, it may be recommended, considering all the factors, but that's...
Okay, Dr. Anyano,
within
I
the
have a
purview.
child who is 11
Okay.
and she has sensitive teeth.
What-
So I bring her to you.
But the point is that if you think about the prevalence rate in Nigeria, it's more common between the age of 20 and 40. You hardly see children come up with this sensitivity. You get- But once in a while, they present. So in that case, if you see a child with a sensitive teeth and it's proven, it's demonstrated that the child has tooth sensitivity, then you have no choice than to place the child on, a rapid action, if need be.
No, you're talking of a child below 12. now.
Oh, below 12. No.
You cannot introduce that child to rapid
To
action.
whether it is rapid action or ordinary Sensodyne, you can't.
You can place on the normal toothbrush that contains fluoride.
Okay.
Any toothpaste
Toothpaste, yeah.
that contains fluoride, the child can take. But once it's below 12 years, it's contraindicated.
Okay.
It will give.
Dr. Yoha,
Yes.
like Kayode said, that this seems to be a miracle toothpaste, and everything that is miracle doesn't come cheap. As far as toothpastes go, where would you place the price of
Okay.
Rapid Action?
All right. Well, Sensodyne Rapid Action is actually a premium toothpaste because it's therapeutically formulated for a specific need. Not everyone suffers from sensitive teeth, but a lot of people suffer from sensitive teeth. As a matter of fact, over 75% of people who suffer from sensitive teeth don't use a simple remedy like Sensodyne Rapid Action. So it's priced at a premium, but again, it's affordable for people who have that condition when you weigh the benefit.
So in essence, you're saying it's not for everybody. So it's not a case of everybody go out, go get it. Unless you have sensitive teeth,
Yeah.
then you shouldn't bother buying it. You should get other products of Sensodyne.
I think you just captured the summary of it. It's Sensodyne is specially formulated for people who have sensitive teeth, and it's a therapeutic formulation for that need state. So if you have sensitive teeth, want you to think of Sensodyne as a simple and effective solution that can provide relief from that pain.
And how often should I use Sensodyne
Okay.
to get permanent relief?
Okay.
Once a day, twice a day, once a week?
Yeah, well, Sensodyne, but the direction is to use it twice a day, and it's important that, people are aware of this, because if you don't use it as prescribed, just like a medicine, you won't get the expected results. So using it twice a day, guarantees the relief that comes with the promise of the product.
And where can I find it? Is it everywhere?
Well, it's available in markets and stores near you. So
Markets.
yeah, we're looking at supermarkets.
Sangras Market.
Supermarkets and stores and malls. You can find it there.
Wherever you go, you will find one. Well, so your advice is anybody with sensitive teeth, go get one.
Yes, that's right.
Okay.
Sorry, in addition to that, please, I want to point out that it's not all tooth pain that's caused by sensitivity. You get so people should endeavor to see their dentist at least every 6 months. There might be some underlying problems. You get so you have to establish what is causing the tooth pain or
Sensitive.
ache, depending on what the patient is
Well,
present.
an ache is not the same thing as sensitivity.
Well,
I have tooth issues, so I know the difference.
sensitivity is a short, sharp pain it's very intense. As soon as the triggering factor is removed, pain disappears. But there are toothaches that comes and it stays. You get, even when the stimulating
That is
factor,
toothache.
yes, when the stimulating factor is removed, the ache is still there, which means there is an underlying factor causing the pain. So you need to sort out the factor.
So tooth decay and things like
Things
that,
like
they
that.
are different.
So it's not in all cases that Sensodyne takes care of toothache. You see some people, when they have toothache, they rush to the nearby store, get Sensodyne, hoping that Sensodyne will take care of the toothache. That's not the case.
That's
It doesn't take care of aches, it takes care of sensitivity. Thank you very much.
Thank you. We've been chatting with Doctors Ikenna Onyana, who's a dentist, as well as Davis Iyoha, who's a dentist, as well as brand manager, Sensodyne and Parodontox. Thank you very much for
Thank you
coming.
very much. Thank you.
Sunrise will return with the home stretch in just a moment. Having stayed this long, you might as well just see it through.